hearing a lot about different communities who are really struggling with their health, whether it's in rural America with the opioid crisis or really high maternal death rates with African American women. There are a lot of people across this country who are really hurting.
And as the healthcare debate heats up, the rhetoric around whose hurt matters the most can get divisive. Should we focus on fixing racial and ethnic inequities? Should we prioritize rural health? Who has the most urgent need for solutions? At Families USA, we decided to take a deeper dive into the data to see what's really going on.
So what did you find out? Is being a person of color in this country still something that really undermines your health?
Oh, absolutely. There are lots of serious health problems where African Americans, Latinos, Native Americans, other people of color struggle much more than white people do.
That's not surprising at all. Many factors play into this, from structural discrimination that really affects the kind of opportunities and healthcare risk you have, to just how it affects your body and your mind when you're dealing with racism on a daily basis. So I do have one question.
Yeah?
What about working class people in this country? Are they still suffering?
They are. And what's interesting is it's not just white working class people, it's people of color as well. Whatever your race or ethnicity, whether you live in the city or the country, if you are working class in the United States, you have a much, much greater chance of experiencing serious health problems.
And you know who's actually suffering the most? Women. Working class women of every race, of every background, in every zip code across this land. Compared to college educated men, a working class woman is more than 3 times as likely to have at least 2 weeks of bad health in any given month.
And the problem has gotten worse, a lot worse in recent decades, not better. Looking at how many people have poor health for at least half of the month, the gap between working class women and college educated men has grown by more than 30% in less than 15 years.
So listening to women is important in healthcare too.
Oh yeah.
But wait, another question.
Sure.
Wasn't the Affordable Care Act supposed to be helping with this?
Yeah, and it looks that way. Once the ACA went into effect, the health problems of both working class families and people of color stopped getting worse and started getting a little better, but we still have a long way to go.
That's for sure. There's still millions of people in this country that don't have health insurance, millions more whose coverage is threatened. And we also know that having a health insurance card is just the beginning, right? There are so many more things that we have to work on, including affordability, making sure there's better access, improving quality, and also dealing with all the non-healthcare factors that really influence our health.
Yeah, the bottom line is that both healthcare systems and the factors in our environment that make a profound difference to our health and well-being need a lot of attention. They pose a lot of problems for many different people in this country, and we need leaders who will step to the plate and do something about it.
The fact is, in many ways, we share a common struggle, even as some groups may have, an additional layer of challenges. For example, as a Latina mom, when I look at my child struggling to breathe through an asthma attack, I am sure that a lot of the questions and worries that I have are not that different from any other mom of any background who has an asthmatic kid. But on top of that, there's a whole other layer that I worry about, and it's all of the inequities that are well documented about bad outcomes for Puerto Rican kids when it comes to asthma.
So we need effective solutions for common challenges, even as we continue to fight hard to stop inequities.
It all comes down to this. Our country is getting more and more diverse, and that's a good thing. But the future of our country then depends on everybody thriving. Everybody. So we have to ask ourselves at this point one very basic question.
Will we let the rhetoric, the political rhetoric, distract us and divide us, or are we truly all in this together?
It's time for all of us to decide.